Hello, dear students and esteemed learners. Welcome back. Welcome to my course on Sociology of Health. Now, this is lecture number 29, and in this lecture, we'll talk about the Sustainable Development Goals, its background, the approach, and health related issues. So, in this week's courses, we have been talking about the Millennium Development and the Sustainable Development Goals and the health targets and specific achievements. So, previously, we talked about several things like we try to understand development, we try to understand different models or paradigms of development like social development, human development, economic development, and also sustainable development. And then we also talked about the various goals of the Millennium Development Goals and achievements also. So now in this lecture, we will talk about the Sustainable Development Goals, which are very important, very contemporary, and we will see that these goals are applicable as of now in contemporary world because these will continue to be there in operation till 2030, right? So these are very important and relevant, and these have widened the scope of development. The concepts that I have included in this lecture are meaning of the term sustainable development, then the sustainable development goals, which are actually 17 in number. We will talk about very briefly each of those goals. Then we will talk about goal number 3, which is related to good health and well-being. And within that goal, we'll talk about all indicators or targets and whatever information is available. And simultaneously, we also try to see what are the facts and figures as of now at global level, because we need to understand the problem at the global level. So these are the things that we will discuss. Now we go to our first slide. And here I have mentioned the definition of sustainable development that we talked about earlier also, but just for a kind of recapitulation, I'm talking about this. So sustainable development is development that meets the needs of the present generation without compromising the ability of future generations to meet their own needs. That means it talks about intergeneration parity. And in simple words, it says that whatever resources are available on this planet Earth, those resources should not be overused by the current generation or the present generation. Those resources should be kept or preserved for future generations also, because these resources are finite. That means it talks about understanding the resources which are finite or which are infinite. And if there are finite resources, limited resources, then we should not make an overuse of that. We should keep them for the future generations also. That is point number 1. The second important thing is basically taking care of the environment, because environment is something which is very important for survival of humans. Not only humans, rather all species. The planet itself. In last 100 years, we have been witnessing that the planet is undergoing several types of changes, and very often we term those changes as climate change, and sometimes we get to know the extreme kind of condition which suggests that the existence of the planet in itself is under threat. There are so many things, you might have read those things basically. So sustainability will not be possible if we compromise with the environment. And so this approach talks about making optimum use, but in such a way that we should preserve the environment. Then it negates the mindless exploitation of resources, because resources are finite. And there are multiple problems related to the mindless utilization of the resources. So simultaneously, we also need to talk about those resources which are renewable. So if the resources could be renewed, then we can make use of that. So this sustainable development is talking about multiple things, but at the core of this is this, that the environment should be taken care of appropriately so that it continue to remain a place worth living, and we should have enough resources for the future generations, and we never know how long this planet or this human species will continue to be there. That means we need to keep maximum for the future generations. So with this kind of understanding, we move to this very important point, that for sustainable development to be achieved, it is crucial to harmonize three core elements, which are economic growth, social inclusion, and environmental protection. Economic growth is important. Along with that, social inclusion is important, and that is why we talked about social development, and we categorically understood that without social inclusion, basically we cannot achieve any other target, any other goal. And then environmental and climate protection is again very important. So with the combination of these three, we come to the understanding of sustainable development. At the global level, the 17 sustainable development goals and 169 targets of the new agenda will be monitored and reviewed using a set of global indicators. So there are 17 sustainable development goals. Out of those, 169 targets, and there are good number of global indicators. The global indicator framework for sustainable development goal was developed by the interagency and expert group on SDG indicators, that is also known as the IAEG SDG, and agreed upon at the 48th session of the United Nations Statistical Commission held in March 2017. The sustainable development goals are not legally binding. This is very important. That is why I have highlighted this. It's a legally not binding, but the United Nations and the various agencies basically recommend this, suggest this, and it also says that the countries are expected to take ownership and establish a national framework for achieving these 17 goals, and implementation and success will rely on countries' own sustainable development policy, plan, and program. That means the countries need to have their own sustainable development plans and policies. And so it would be expected from all the nation states to have their well-defined, comprehensive sustainable development plans. Now, with this brief background and the approach, we come to the 17 sustainable development goals. Just have a look. We'll talk about all these 17 and then try to identify some pattern. You may see in the slide I have highlighted the goals in 3 different colors, right? So we'll try to understand what kind of pattern is basically emerging. Goal number 1 to 6. So goal 1 talks about ending poverty in all its forms. Now, poverty is a big challenge. In the Millennium Development Goals also, we talked about poverty, and then there we talked about multiple numbers, right? So those numbers are relevant because those numbers were identified this millennium, and we have developed an understanding that the problem of poverty was existing. So we will talk about the poverty related goals and targets also in this or in the next lecture. Then zero hunger. Zero hunger is a global goal, but we have not achieved it. And we will see that unfortunately the countries are performing very poorer in terms of achieving the goal of zero hunger. But for health, zero hunger is actually a desirable condition, and not only desirable, a mandatory condition. Because if we cannot fulfill the hunger needs of the population, then what kind of basically health we would be thinking of or talking about? Then education. Education is certainly very important. We all understand the importance of education. Then gender equality and women empowerment. In one of the previous lectures, we also talked about the HIV, AIDS, and other issues related to maternal mortality and then infant mortality. Now, all these problems are basically related with each other. And for taking the proper mechanism, for having the proper mechanism to address these problems, we need to make a very well prepared, comprehensive, focused approach for women's empowerment, because without that, it, those goals could not be achieved. So, women's empowerment is one of the important goal. And when we talk about women's empowerment, then basically role of women in decision making is becoming very important. And then water and sanitation, we have talked about this earlier also. We know that water and sanitation are very important components of public health. So when we talk about sustainable development goals, we need to talk about water and sanitation. Water is the most essential thing for our survival. So without water, nobody, neither humans nor animals, can ever think of surviving. So this is most essential, and unfortunately, there is gross disparity in the distribution of potable water, that is the safe drinking water. Now, we come to the next set of goals which are highlighted in blue. But before going to the next set, I think now you might be getting an idea that all these 6 goals that we just talked about are appearing very closer to the goals that we talked about in Millennium Development Goals. Yes, these are very closer to those goals, but the time period is different, right? So these goals are closer to the human development approach, and all those goals have been included in the Sustainable Development Goal. And that gives you the idea that sustainable development is basically a broader approach. Right. Now we come to the next set of goals. Goal number 7 is talking about energy. Now, energy is very important, as we stated while defining sustainability, that most of the finite resources have been used for making energy, like coal, like petrol, etc. These are finite, these are limited. So if we keep on exploiting those, then very soon those will come to an end. That means the world will suffer from the problem of energy crisis. And so at this point of time, we need to develop the alternative mechanism, alternative sources of energy, the renewable sources of energy. And so this is very important. The next is goal number 8, which is economic growth. Yes, of course, economic growth is the driving force. No model of development can ever work without this. So in every model of development, we are talking about economic growth. And so in the sustainable model also, we are talking about economic growth. But the only thing is this, that economic growth should take place within certain constraints or limitations, so that we can have we can maintain an optimum level of growth, right? We need to maintain an optimum level of growth which should be sustainable, and for that we need to make a correction in the approach. Why I am saying making a correction in the approach? Because earlier we have seen a mindless exploitation of the resources on the name of economic growth. So that kind of approach will not work. Then comes the next goal, that is goal number 9, which talks about infrastructure and industrialization. Yes, industrialization is important. The world that we are living today is basically an industrialized world. And whatever changes we are witnessing today in this world, most of these are caused because of industrialization. However, because of certain climatic conditions, because of certain prevalence of pollution, and then several other types of complications or prevalence and occurrence of certain diseases, often we blame the process of industrialization. Actually, it's not the process of industrialization which should be blamed. It is the way we are approaching to the process of industrialization that is important, because industrialization is a process. It depends upon the driving forces, how the nation state is basically regulating that. So if industries are producing the waste, then is there any mechanism for treatment of that waste? That is very important. So along with the process of industrialization, we need to develop appropriate technology and mechanism by which we can negate the negative aspects of industrialization. But without industrialization or infrastructure, we will not be in a position to achieve the our necessities or requirement. So this is important. Then comes the goal number 10, which is inequality. That means the world needs to reduce inequality. We talked about this earlier, and we stated that the social development model is primarily talking about this, that inequality should be reduced and eradicated in all its forms, whether that is economic inequality or social inequality or gender inequality or caste based inequality or any form of inequality. So for the first time, basically these global targets or goals have included the problem of inequality in a very comprehensive way. Now, let me remind you, while talking about human development, we had mentioned the term HDI and IHDI. The HDI was talking about the Human Development Index, and the IHDI was talking about Inequality Adjusted Human Development Index. That means there is increasing demand for inclusion of the inequality adjusted human development, and the result of that demand is getting reflected in the sustainable development goals, where inequality is considered one of the important goals. Then goal 11 is talking about cities, and cities are very important because this is where the urban people are living and the cities are growing, and the problems in the cities are also growing. So we need to have a kind of approach where the problems in the cities could be addressed appropriately and sustainably. So the next goal, which is goal number 12, is talking about sustainable consumption and production. Now, consumption and production, primarily, these are the two processes which are driving the world or the world economy at an elementary level. On the one hand, there is a process of production, and on the other hand, there is a process of consumption. And basically, the optimum connect between this production and consumption is what is actually the driving force for sustainability. So, inclusion of goal number 12 is very important, not only in isolation but for all other goals to work appropriately, because ultimately we are talking about the sustainable development goals. So this sustainable consumption and production is applicable in all other goals also. So here you can see that from goal number 7 to goal number 12, we are talking about so many important things like energy, then economic growth, then infrastructure, industrialization, inequality, cities, and sustainable consumption. And because of the inclusion of the two very important things, one side economic growth and second side basically minimizing inequality, we can say that these set of goals basically try to include the economic development model as well as the social development model, because it's talking about economic growth as well as minimizing inequality, that is social development. So The first six goals talk about the or focus on the human development. Then the next goals basically talk about economic as well as social models of development. And then we come to the last section, that is goal number 13 to 17. And goal number 13 is exclusively talking about climate change, something that we talked about earlier also. Climate change has become a very serious, very severe problem for the world today. It has actually threatened the existence of humanity because the extremes, the climatic extremes that we are witnessing, is a very big problem. We are in no position to control the adverse impact of the climate change, and we cannot predict even that. And unfortunately, the climate change as of today has become a reality. So it is not just to say that we are making some kind of prophecy. We are witnessing the impact of that in our everyday life. So this is very important. And the next important goal here is goal number 14, that is oceans. Oceans cover a huge, basically, portion of the planet, but we are not talking about that. Although there are immense resources, but there are immense challenges also. We need to talk about that if we talk about the safety of the planet. Then comes the biodiversity, forest, and desertification. These are all very important issues if you look at it from the perspective of the environment or climate or ecology. But we all live in that ecology. If one part of the ecology is getting destroyed, then the other part will get the negative impact. So we need to look at the things in their entirety, and so these are all very important. Biodiversity is very important. If we compromise with biodiversity, then we don't know what kind of thing may happen. Actually, we cannot predict, nobody can. So biodiversity and preservation of it is very important. And then comes the next important goal, that is goal number 16, which is peace, justice, and strong institutions. Yes, these are very important. We cannot survive without these. And then partnership, basically. Partnership between the developed part as well as the developing part, and there can be different modes of partnership. So these are basically very important goals which talk about climate, which talk about sustainability, and all these 17 goals are interrelated, interconnected, and talk about the ways and the mechanisms by which we can ensure peaceful, harmonious existence in this planet. So we had a brief review of these 17 important sustainable development goals. Now we need to talk about the health related goals. So goal number 3 is talking about good health and well-being, and there are good number of goals identified here. You can have a look on these goals, and then I have also included certain facts and figures related to these goals, which are primarily related with the child health, maternal health, and HIV/AIDS, malaria, and other diseases. So we will talk about the goals one by one, but you are already aware of some of those goals because we have talked about some of these in the previous lectures also. So what is goal number 3.1? Why did I mention 3.1? Because this is related to goal number 3, right? So there are other goals, goal number 1, goal number 2, then 4, 5, 6, as we have just seen. So this particular points are referring to goal number 3. So 3.1, 3.2, right? It will be easy for us to remember the things. 3.1 says that by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live birth. We already understand meaning of the word maternal mortality ratio. So the new target is given here, and the world basically needs to abide by. Then the next goal is by 2030 end preventable death of newborn and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per thousand live birth, and under 5 mortality to at least as low as 25 per 1000 live birth. So these are the specific goals related to prevalences of infant mortality, that basically we need to reduce. We need to reduce the neonatal mortality as well as the infant mortality and the under 5 mortality. Then the third goal is also talking about by 2030 end the epidemics of AIDS, tuberculosis, malaria, neglected tropical disease, and combat hepatitis, waterborne disease, and other communicable disease. So, as we discussed in the Millennium Development Goals, so we are given specific goals which are related to AIDS, tuberculosis, malaria, and here you find mention of the neglected tropical disease also, right? Because in the tropical area there are certain diseases which prevail. For example, dengue is considered one of those tropical neglected tropical disease. So these are having the local impact, but they play very crucial role in creating those premature mortalities. So this goal is very specifically talking about these, and then also talking about hepatitis or the waterborne other diseases. Goal number 3.4 says that by 2030 reduce by one third premature mortality from non-communicable disease through prevention and treatment, and promote mental health and well-being, right? So if you have a comparison between these goals and the MDG, then now this 3.4 is becoming very important, because it is not only talking about the premature mortality caused because of the communicable, but it's also talking about premature mortality caused because of the non-communicable disease. And so these are becoming very important. And along with this, it is also talking about the mental health issues. So these goals are becoming new, fresh, and important. Then 3.5 says that the strengthening prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. That means substance abuse is becoming one of the major problems among various age groups, and so there should be prevention and treatment. Then the next goal is talking about by 2020 halve the number of global death and injuries from road traffic accidents. So road traffic accidents are creating huge mortalities. We talked about this particular topic when we were discussing public health, and so we can see that these are basically part of the sustainable development goals. And then a very important thing here is mentioned in goal number 3.7. By 2030, ensure universal access to sexual and reproductive health care services. Now, universal access. We have been talking about the sexual problems or basically the reproductive health problems, but nowhere we have been mentioning that there is a mechanism to provide those services or access to those services. So this point suggests that there should be a universal access. Anybody who is having any kind of problem anywhere should get some kind of facility to redress that problem. That is basically what is universal access, and that will be very helpful in so many things like family planning, then integration of the reproductive health into national strategies, and then combating some of the problems which are basically related with the reproductive health issues. And then 3.8 talks about a very new phenomenon, that is universal health coverage. The world has been witnessing the increase in the out-of-pocket expenditure for meeting the healthcare requirements. When somebody is becoming sick, then he or she is basically in need of some kind of treatment. And then when he or she is not having the government facility for that treatment, then the kind of expenditure is basically borne by the individuals, and that is known as out of pocket expenditure. And this out of pocket expenditure is creating a huge burden. And this is one of the important causes of impoverishment, right? So on the one side, we are talking about eradicating poverty, and on the other side, we are having high expenses for medical care, which is creating a kind of impoverishment. So the universal health coverage talks about addressing the problem of the catastrophic impact of the medical care, the cost of medical care, right? So this is a very important thing. It talks about making universal health coverage accessible to people all over the world. And then goal number 3.9 talks about substantially reduce the number of death and illness from hazardous chemical and air, water, and soil pollution and contamination, etc. And then there are basically few other goals also, like strengthen the implementation of World Health Organization Framework Convention on Tobacco Control in all countries. So these health and well-being related goals give us a blueprint on how to move further, right? In short term, it talks about the 2030, the time period up to 2030, but at a larger level, it suggests us the way by which we can approach to the future. So these are very important. Time will tell to what extent we will be successful in achieving all these goals within the time frame. But for that, we need to know what are the conditions prevailing as of now at the global level. And here I have mentioned some of the facts and figures which are related to the prevalences at the global level. We have discussed this concept in the previous lectures, so we will not discuss these things, but I have mentioned the figures for your convenience. If interested, you can have a look on all those figures related to health of the children and maternal health, and also the prevalences of HIV/AIDS, malaria, and other diseases. So with this, we come to the last slide. And before we close, one small think about this problem. Try to compare the health targets of Sustainable Development Goals with the Millennium Development Goals. Try to think over, right? And then one activity question, which is identify some of the government schemes which address the issues related to Sustainable Development Goals. So identify at your level, right? So these small exercise will give you some kind of insight about the topic that we are talking about. So with this, we come to the end of this lecture. Thank you very much for being with me, and we will meet in the next lecture soon. Take care then.